Hello, I'm Dr. Rohini, one of the consultant reproductive medicine working in Vardhan Fertility Centre. So today I'm going to talk about the role of ultrasound in the treatment of infertility. So when I am talking about ultrasound, that means that in case of treatment for fertility patients, we usually do transvaginal ultrasound. So what is transvaginal ultrasound? So as the name signifies, in this we would be using a transducer which would be inserted in the vagina and the ultrasound scan will be done. The advantage is that when we use a transvaginal transducer, all the pelvic structures and organs of interest, that is uterus, ovaries, and fallopian tubes, they are very near to the transducer, and we get a very clear image compared to when we do a scan from above, that is trans-abdominal ultrasound. So I'll start with explaining how a transvaginal ultrasound is done and what you can expect. So when you come to our clinic, so when you are taken for scan, first of all, it's advisable that you come in comfortable clothes, wear loose pants, because for this scan, since the scan is done through the vaginal route, you would have to take your uh, pants and underpants, and then we would be maintaining the utmost privacy for you. And the scan is done when you will be put on your back, and then we will be covering you up well so that you feel comfortable, and then we'll be taking the trans vaginal probe, and a very clean sterile probe cover would be put on it, and a gel would be put on top of the probe, and then this transducer is inserted into the vagina and the scanning is done. This scanning is usually not painful. It may cause a little bit discomfort in few women, otherwise it's not painful. So now next I'll tell you the role of these scans. So transvaginal ultrasound, like I told you initially, it gives a very clear picture of uterus, ovaries and tubes. So usually any woman who has any bleeding problems, any abdominal pain, it helps in the diagnosis of diseases. So in case of infertility per se, when patient scan is very important, you would be called for scan frequently. So I'll tell you what are the reasons why we call you for scan frequently. So first of all, on day second of your periods, we call you for a scan, and that day we would screen you. We would have a look at the uterus, and it would give us an idea whether there is any mass in the uterus, and we'll also see how is the endometrial lining, whether within the endometrial cavity there is any mass like fibroid or polyp, and then we would have a look at the fallopian tubes. The fallopian tubes as such will not be seen normally in the scan, but if there is any abnormality, like if there is any infection, swelling of the tube, that can be noted. And then next we will have a look at the ovary. In the ovary, on second day, we would see the number of follicles that you have. So this follicles should be ideally 7 to 15. This gives an idea about your egg reserve. And other than that, we'll also have a look whether there is any cyst or any other kind of disease or pathology in the ovary. So this would be your baseline scan that we do when you come to our clinic on the second day. And thereafter, we'll call you on scans depending on what kind of treatment that you're undergoing. So in case if you're undergoing an ovulation induction treatment, which is the initial first line treatment that we do for patients, in that case, we'll be starting you on some treatment, and then we'll be calling you probably 1 week after the first scan, just to have a look how the follicles are growing up. And then if the follicles are growing adequately, that is around 1.5 millimeter per day, then we would call you again after 2 days, and we would do this frequent scanning till the follicle reaches around 18 to 20 mm. And then we would be giving an injection for release of egg. And then we would again call you after 36 hours, day after giving the injection, to see if the egg has ruptured or not. And during this scan, we would be having a look. As we do the serial scans, along with the size of the follicle, we will be also monitoring whether the endometrial lining is growing thick enough or not. So, because for a good pregnancy to happen, we require an endometrial thickness of at least 8 millimeter. So this is what happens in case of ovulation induction. And then along with this, when we do a procedure called IUI, that is intrauterine insemination, the same procedure is followed up, except that instead of scheduling the time of intercourse that we do in case of ovulation induction, in this case, we would be taking the semen from the husband and separating the high quality sperm and directly inserting into the uterus. The same procedure is followed for IUI also. And then now the next step is IVF procedure. In IVF, we will be calling you for, again, the same kind of thing will be followed up. Second day you will be called up, and we'll be seeing the number of follicles, and we'll be giving you injections. And then on 5th day to 6th day, we'll be again calling you and seeing whether the follicles are growing up well. And then after 4 days, again we'll call you, and this kind of serial monitoring will be done. And when we feel that at least 3 follicles are more than 18 millimeter, we would be giving an injection for release of egg, and then we will be scheduling your egg pickup procedure after 36 hours. So this I have told you about the monitoring part. Now where else is scanning used in fertility? So like I told you, the IUI procedure, that can also be done under ultrasound guidance. We have noticed that the success rates are much more higher when we do it under ultrasound guidance. Next, the egg pickup procedure that I told you about, which is done in the IVF to harvest the eggs, that is also done with the help of a transvaginal ultrasound. And following the egg pickup procedure, also we would be following you up with the help of a scan to see if any fluid collection is there. And once you get pregnant, the initial first 3 months, a transvaginal ultrasound is done, because the uterus is still within the pelvis, and still, so we get a better image quality. And once the baby crosses 12 weeks, we shift you to an abdominal ultrasound. So now you know that why you are frequently called for ultrasounds, and this would give you an idea about how to be prepared and what to expect when you come to the clinic. Because a lot of patients, when they go for a general health checkup, the checkup is done by a trans abdominal scan, so they don't have much idea what to expect and anticipate, and that causes a lot of anxiousness and nervousness in the patient. So I hope this video was a little bit helpful to you and would make the whole procedure much more comfortable for you. Thank you.